All right, sorry. And
Okay, so
you can go really quick too, by the way.
Cervical compression down, see if there's any peripheralization. You document what their symptoms are. Distraction, you just grab a hold and you're just lifting up. Once again, you're looking for what? Relief of their symptoms, okay? Spurlings, you're going to start by having them turn their head to either side, lean their head back. If that already lights them up in terms of peripheralization of their symptoms or increased pain, don't put the compression, but the test would then be apply some compression to both sides.
Do you want to mention upper limb tension tests here?
We can talk about upper limb tension testing. For the median nerve, we're just going to go ahead and stand up. I want you to take your wrists and I want you to extend them. Okay, I want you to turn your palms up and I want you to bring your arms out to the side and tell me if you start to feel symptoms and where you feel them. Okay. Now I want you to turn your palms down. I want you to flex your wrists or bring them back and lift your arms up and tell me if you get any symptoms there. Okay, good. Now I want you to take your hands like this. I want you to bring them up like this towards your face and tell me if you get any symptoms. Okay, good. That'll be for the ulnar nerve. Okay, you could also incorporate that. Good. All right. Shoulder tests. Right. Go shoulder. Start with speeds. Speeds test. Arm is straight forward, 90 degrees. Extend it. Put my force here. I want to feel along the bicipital groove. I have him resist me pushing him down. I'm going to push on you. You're going to hold. Okay, you ready? And I see if he has pain. Where's your pain? If he's got pain along the bicipital groove, that could be bicipital tendonitis. If he has pain more medial to it, it may be labral. So labral, you can differentiate in this as well. It's not a very specific test, guys. It gives you an idea. Okay, so you're not going to be able to say it's definitely the one or the other. You just have an idea that it could be. Okay. We're going to call this the O'Brien's test. Horizontal adduct the arm to about 45 degrees, 30 to 45 degrees. Internally rotate the arm. The shoulder is flexed at 90. I'm going to have him resist me pushing him. If he gets pain, where? He gets pain in the front of the shoulder, anterior shoulder region, positive for labral involvement. Thumb up, push up. Says no pain there, but now I have pain in my AC joint. He might have AC joint involvement. Nearest test. This is the modification. Internally rotate the arm first. Bring the arm up into full flexion and ask them if they get pain at the end of range. That's nearest. Internally rotate the arm first. Bring the arm up into full flexion. Okay? Hawkins-Kennedy test. Horizontally adduct the arm to neutral, or about 0, maybe slightly forward. 90-90 position. And now I internally rotate the shoulder and I see if he gets pain in the top of the shoulder around the AC joint or subacromial region. Make sense? That's called the Hawkins-Kennedy test. Modified Hawkins-Kennedy, what I teach is you can have the patient actively do it. They can lift the elbow up and see if they get the same symptoms. Okay? Next will be empty can test. Arm is out at kind of 30 degrees or so, shoulder elevation or abduction. Okay? I'm sorry. Horizontal adduction, we'll call it horizontal abduction. Scapular plane, thumb down. I have him push up or resist me pushing him down and see if he gets pain. And this one you can also document for weakness, because if it's painful and it's severely weak, you might have a rotator cuff pathology. Drop arm test. Arms out here at 90 degrees. Tell him to relax his arm as much as he can. Relax your muscles. Okay, I'm going to let go. I want you to hold it there and see what happens. Now, if he had a pathology, or pretend you do, I'm going to go ahead and relax and go ahead and hold your arm. And what's going to happen is his arm's going to, it's either going to drop or he's going to do this. Okay. What else am I missing? Impingement sign. This isn't in any, I learned this through courses I've taken, just having them reach across their body and try to reach it over that way. You can see if they actively do it. If they get pain, that's an impingement test. If you forcefully adduct their arm, forcefully on your own, and they get pain in the AC joint, they probably have some AC joint involvement. That's a forced horizontal adduction. Okay. All right. Elbow. Valgus stress test. Hand Here's the joint line, directly below the joint line, directly just slightly above the joint line, and I want to introduce a stress. So I'm gapping the medial elbow. Think about opening up the medial elbow. I do it in full extension, and I do it in some range of open pack. I want to look at the open pack position, see how loose it is, and if they get pain, I want to take them closed, and in this position we should get no movement if it's an intact ligament, correct? So if I get lots of movement and clicking, a lot of times you feel a click and almost like a judder, and they get pain, you probably have a torn UCL or a partially torn UCL. Varus would be the other direction, same thing, hand here like this, and I'm just introducing a varus stress at the elbow. Okay? All right, Tinel's, so we look at cubital tunnel syndrome, tapping at the ulnar nerve, on the ulnar nerve at the cubital tunnel, and just a little bit distal to there, and see if they get any symptoms. Okay? Here in the, right here in the groove. Not up here, not down here, but right here in the groove. That's going to differentiate out ulnar nerve irritation. Also here at the wrist, where the hook of the hamate is, and the pisiform for Guillen's tunnel. Okay? Lateral epicondylitis tests, resistive finger, long finger extension. Go ahead and push up. And I resist, see if he gets pain. Mills test is going to be palpate on the lateral epicondyle. Elbows like this in kind of a resting flexion. And I go ahead and I pronate his forearm. I flex his wrist and I extend the elbow and see if he gets symptoms. That's Mills test. Chairlift test. Patient hold his arm palm down and pick up the chair. If he gets pain, it's a positive chairlift test. That's all for lateral epicondylitis. Medial epicondylitis, it's just going to be passive wrist extension, the elbow extended, see if it gets them some pain, or have them resist wrist flexion, and if they get pain as well, would be positive for medial epicondylitis. Cozen's test, Cozen's, C-O-Z-E-N, resistive wrist extension, they get pain in the lateral epicondyle, or around that region, it's positive for lateral epicondylitis. Wartenberg's sign is just abduction of the fifth. And so what you'll do is you'll say to your patient, go ahead and reach in your pocket, grab your keys, or they'll tell you, I can't reach in my pocket because I keep getting my finger caught. Okay? That will differentiate involvement of the ulnar nerve as well. Okay? Carpal tunnel test. Thank you. Tinel's at the wrist. Okay, I just zinged him. Not up here, guys. The carpal tunnel sits here. Doesn't sit up here in the forearm. Doesn't sit here in the middle of the hand. It sits right along here. Okay? Phelan's test. Have them take both their palms, go back to back, backs of their hands, and have them drop their elbows down a little bit so they get more wrist flexion. They're going to hold there for about 30 seconds, see if they get any increased symptoms. Any tests I missed?
Do we do milk?
Milking's test. Okay, so once again for medial collateral ligament instability, you're going to support their arm, 90 degrees abduction. They're in the pitcher's position, 90-90. You can take a hold of their thumb, make sure their thumb's okay, and you're just going to pull back on the thumb, gapping medial collateral. You can put your finger there to feel it, and see if they get pain. Okay? You can have them do it actively. I'm not going to ask you to do that today, but they can do it as well to themselves to just assess it as well. Anything else? Good?